Hello, this is the first of three videos for this week's modules on the United States healthcare system. This first one is about the Affordable Care Act. Now, I don't know what's going to happen to the Affordable Care Act, so I'm just going to tell what it was like before the past couple of weeks because or should I say the first 2 weeks of the new administration in Washington. We do know that the current president, during his campaigns, said that he wanted to dismantle the Affordable Care Act. He referred to it as Obamacare, which is the nickname of the act. We do know that there are people that were excited that Obamacare was going away because that they had the Affordable Care Act. They didn't realize that the Affordable Care Act is another name for what they refer to as Obamacare. But we're going to talk about a brief history of the act to start with. The Affordable Care Act is built on prior efforts to get some sort of universal health care or health care for all in our country, mostly driven by Democratic politicians. We're going to talk about Medicare and Medicaid. Those were started in the 60s by Lyndon B. Johnson's administration when he was in power. It provided some coverage for the elderly and for those that are disabled or the very poorest among us. In the 90s, the Clinton administration really tried to get some sort of universal health care coverage where instead of having private insurance, everyone would have a national insurance, but that failed. And so when President Obama was campaigning and became president, one of the planks of his platform was that he would find some way to have some sort of insurance coverage for people who at the time could not afford it. Before Medicare and Medicaid started, people had the first kind of health insurance was Blue Cross Blue Shield. And in the early days, it was not very expensive, and healthcare wasn't very expensive. But what seemed to happen is, if you look at a graph, you'll see that, unfortunately, before we had all this insurance, healthcare wasn't expensive. I think when I was born in 1963, I believe that my mother's hospital stay was like $20. It was definitely less than $100. I think I tried to dig it out of her hope chest, which is in my bedroom now. I couldn't find it. I know it's there somewhere, but it was extremely inexpensive. One of the things that happened, things started getting more expensive, and then the health insurance came into being, and most people, it was a benefit of their work. Now, what happened when we started to see more people being covered by health insurance, we saw that because I'm not paying that bill and the health insurance companies are paying the bill, charges started growing. And this growth in costs benefited the insurance companies and the healthcare system also. But then, by the time the 80s rolled around, really healthcare costs started to be enormous, especially for those who were under or uninsured. And they started to try to think of various ways, and we'll talk about that a little later. But all of these things were built prior. It's the things that the Affordable Care Act was built on. Um, the definition of the Affordable Care Act. The Affordable Care Act, also known as Obamacare, it's a comprehensive health care reform law enacted in the United States in 2010. It was signed into law by the president at the time, Barack Obama, with the primary goal of improving the nation's healthcare system by increasing access to health insurance, enhancing the quality of care, and controlling healthcare costs. The overreaching goal is reforming the healthcare system to make healthcare more accessible, affordable, and of a higher quality for a broader, a bigger section of the population. So it had a lot of reforms in it and provisions to address various challenges within the healthcare system above and beyond just providing the healthcare marketplace so that more people could become insured. As I said already, in 2008, there was the presidential campaign when President Obama was running. He advocated for comprehensive health care reform because so many people were suffering and not covered. In 2009, they started trying to it was his top priority. They started to work with the House and Senate to work on this. Each house the House and the Senate both had separate versions, separate things. But one of the most important thing that was covered was not just affordable care, but patient protection. The act is actually called the Patient Protection and Affordable Care Act. The Senate passed its version in 2009 in December. The House passed it in November. They worked together to reconcile. And by 2010, in March, President Obama signed this act into law. It had several goals: expanding Medicaid, creating health insurance marketplaces so that there could be affordable insurance for people who were not currently covered, providing subsidies to make insurance more affordable, and implementing consumer protections such as prohibiting insurance companies from denying coverage based on pre-existing condition. One of the biggest things, and the thing that I truly hope is not reversed about this act, was the fact that insurance companies couldn't deny you care based on a pre-existing condition. People were locked in their jobs if they had insurance because they knew if they had a pre-existing pre-existing condition and they tried to change jobs and there was a new insurer, they might not be covered. Okay, so then there were legal challenges. Almost as soon as it was passed, people started trying to dismantle the Affordable Care Act. One of the most significant cases was National Federation of Independent Business versus Sebelius. It went to the Supreme Court in June 2012, and the court upheld the majority of the Affordable Care Act's provisions, including the individual mandate that said everybody needed to have health insurance. It said it was constitutional. So they rolled out over several years. It was gradual. They didn't just boom, the Affordable Care Act was implemented. The health insurance marketplaces or exchanges were established to facilitate the purchase of insurance, and Medicaid expansion was encouraged for the states. The thing about the marketplace, there was challenges because the website didn't work well at first. But the thing about the marketplace is one of the reasons insurance companies give better rates to businesses is because there are multiple people involved that they're insuring. And the marketplace is supposed to replicate that like the government is saying, here, you're going to insure all these people, and so they can get a better deal. Ongoing impact and challenges. Well, right now, the current president in power does not like the Affordable Care Act and thinks that it should be dismantled. Um, the thing is, it expanded access to healthcare coverage, but these debates, its impact on cost, coverage, and the overall healthcare system continue. It isn't beloved by all. What are the major provisions of the Affordable Care Act? The expansions of Medicaid eligibility. Prior to the Affordable Care Act, see, Medicaid is in the states, and eligibility for Medicaid varied from state to state. There were different income thresholds for you to be eligible. The ACA, it sought to create a more uniform standard so that if you move from state to state, it would be similar. And it said one of the things that it put into place was to cover all individuals whose incomes were up to 138% of the federal poverty level. That's the set standard income threshold for Medicaid expansion. What's really sad, that margin accommodates people who might not have been previously ineligible at 138% of the federal poverty level. The goals: closing the coverage gap that existed in many states. What would happen is people would go from state to state too, and that wasn't good. If you knew that one state had you had an easier time getting Medicaid, people might move. The coverage gap, though, it's for people who they were employed, but they didn't earn quite enough. They earned too much, to qualify traditional Medicaid, but not enough to be able to get the subsidies for private insurance through the healthcare marketplace. So they found a way to close that gap. And the federal government provided funding to support the Medicaid expansion to the states. Initially, the feds covered 100% of the cost for newly eligible individuals, and then it went to a permanent minimum of 90% coverage for eligible individuals. While the act strongly encourages states to expand Medicaid, we know that states have rights, and the decision to expand was left at the discretion of the individual states. As of my knowledge, as of January of 22, there were states that did not participate, and I anticipate we're going to see more and more as it gets dismantled. More and more states are going to remove themselves from participation in Medicaid expansion because they're going to get less money from the federal government. There was a great impact. Medicaid expansion, it was crucial in reducing the number of uninsured individuals, especially among low-income adults, because children have CHIP. They were already covered. So it was a very positive thing. The coverage was not only for traditional Medicaid service, but the essential health benefits that are outlined in the ACA that we'll talk about in a bit. This includes preventative services like annual physicals, pap smears, mammograms, etc., mental health and substance use disorder services, and maternity care, as well as other things. There's still ongoing debates and changes. It's a huge subject of both political and policy debates. It'll be interesting to see what happens to the states as we move forward, because I truly believe the next 2 years are going to be crucial for the current administration to see if they can do anything to impact the reduction of the powers of the Affordable Care Act. Benefits for low-income families. The first was the healthcare marketplace. Sometimes they're called exchanges. You can shop for private health insurance plan. They have a range of coverage, and sometimes some people can qualify for subsidies to make it even more affordable if you are eligible. Subsidies and tax credits. The Affordable Care Act provides financial assistance to individuals and families with low to moderate incomes because they give tax credits and cost-sharing reductions from the marketplace. This makes this insurance coverage more affordable for those who can qualify. We talked about the Medicaid expansion already. It's a key driver in the number of reducing the number of uninsured individuals, and those pre-existing condition protection, I think, is one of the most important things that is in the Affordable Care Act, and I'm really afraid of what may happen to that, because I'm sure the insurance companies would like to go back to being able to deny people because of prior conditions. Coverage for young adults. Prior to the Affordable Care Act, once you were 21, you could be removed, or you were graduated from college, you could be removed from your parents' health insurance. The employers and others were not required to cover you anymore. But now, since the Affordable Care Act, you can stay on until the age of 26. This covers young adults who generally are at lower income and they otherwise may not have been insured. Before its repeal, the individual mandate required most Americans to have health insurance or face a financial penalty. It was appealed in 2017. The early years encouraged broader participation in health insurance coverage, because that is one thing that the Republicans were able to do during the first Trump administration, was to get rid of that mandate that required you to have insurance or be punished financially. The increased Medicaid enrollment has been very important for low-income families who qualify. And then just public awareness and outreach. There has been an increase in public awareness about health insurance options, encouraging enrollment, and trying to get people the knowledge, if they are aware, and if they have not explored those options, that they may qualify for when it comes to either Medicaid or the exchange insurance options. So these are the essential health benefits of the ACA. This has to be covered. Ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorders, including behavioral health treatment. And that was a biggie because a lot of insurance companies did not want to cover that. Prescription drugs, rehabilitative and habilitative services and devices, lab services, preventative and wellness services, and chronic disease management, and pediatric services, including both oral or dental care and vision care. In 2023, roughly 40 million, I don't have results for 2024 yet, 40 million individuals benefited from the ACA-related enrollment in healthcare programs such as Medicaid or had purchased from the marketplace. This has substantially driven down the rate of uninsured, but numerous studies have reported that there was a very positive impact as a result of Medicaid expansion. This little graph shows the number of people without health insurance in the United States from 1997 to 2022. You see it's kind of steady at a little bit above 40 million. And then if you look between 2005 and 2010, it goes up. That was during the big recession we had at that time. And then after 2010, it slowly starts to drop until somewhere between 2013, 2014, it really gets lower. Then there was a little increase because in 2017, the individual mandate where you had to have health insurance went away, so it went up, and then it has come down, and it in 2022 it was at the lowest rate it had been in all of that time. This graph shows the percent of people with any health insurance from 1990 to 2022, and you can see that it's going along, and then it goes up, and then it goes down. We had a recession, and then after 2010, you see it start to markedly increase, and we were to the point where 92% of people had some sort of health insurance. This is, to me, one of the most important things when it comes to the Affordable Care Act. It is the protection for pre-existing conditions, and just protection for people in general. They can't take it away. They can't deny you coverage or charge you more because of your pre-existing condition, your history. There's a community rating where they started looking at and setting premiums based on, you can't base it on an individual status. Premiums are determined by factors, age, location, tobacco use, but not on pre-existing conditions. Guaranteed issue. They cannot deny coverage or impose restrictions based on those existing conditions. You have to have coverage for essential benefits, and I talked about what they thought were essential benefits previously. There can be no lifetime or annual limits. There used to be a limit where, it might have been $1 million. Once the insurance company has had to pay for $1 million of care for you, then they weren't going to pay anymore. And what would happen if you had a catastrophic condition like cancer, which can be extremely expensive. You got to the point where they would stop covering you. The dependent coverage extension up to 26, your child can stay on your health insurance. And before it was fully implemented, they implemented a temporary program called the pre-existing condition insurance plans. And that provided coverage for individuals with pre-existing conditions who couldn't get insurance on the private market at that time, to bridge the gap until the Affordable Care Act was fully implemented. There are economic concerns, related to the Affordable Care Act. The cost of premiums, it's still a huge issue, especially for the underemployed or people that are barely making a living wage. They do provide subsidies, but it's still a huge burden for some people. Affordability for middle income individuals who don't qualify for any subsidies or anything results in something called the middle class squeeze, where the middle class may have problems balancing their health insurance needs with other costs. The stability of the health insurance marketplaces is a concern, especially in some areas. Some insurers face challenges in accurately predicting the health needs of the populations they serve, which causes problems. They can either not have enough money to cover the population in their area, or they might have a surplus of money, which is also not seen positively, even though it seems like it would. They don't want people gouging consumers. And then the rise of deductibles and out-of-pocket costs. What a lot of insurance companies have done is increase deductibles, co-payments, co-insurance. And with these high deductibles, it makes it harder for people, even if they are insured, to afford health care, even though they have insurance coverage, which doesn't make any sense. There's always been concern about the impact on small businesses, because businesses who, part of the Affordable Care Act is if you have a certain number of employees, you must provide health care. If you have have anybody who is making more than 29 hours, you are supposed to provide them some sort of health care. The cost of Medicaid expansion are continued concerns, especially now that they backed off the amount the federal government is providing. There's still uncertainty in regulatory changes. There's legal challenges. All of the problems that we are now facing in regards to the Affordable Care Act make it insurers and other stakeholders, they have problems planning to make their long-term investments and figure out how they're going to face any policy changes. If there is somebody who's very pro, universal insurance, it can impact them more. Right now, they don't have to be quite as concerned, because I don't think this administration wants to press employers or states to spend more on health care. The impact on the workforce. Some people were afraid that there would be unintended consequences where people will have less full-time workers, and to try to avoid having to pay insurance, they structure their workforce to have minimum responsibilities. And just federal budget concerned, healthcare is a huge part of our gross domestic product. Even though the Affordable Care Act had provisions intended to offset costs through taxes and fees, the House and Senate, Congress, as they make the annual budget, are always debating the amount of money that should be afforded for health care or health insurance directly. These are the legal challenges to the Affordable Care Act, and I'm sure there will be more coming. I talked about the first one on the list. I'm not going to read these to you, but you can see that there have been many challenges, Texas, California versus Texas, and there have been challenges to the contraceptive mandate where requiring employers to provide contraceptive coverage has been an issue. Especially when it comes to religious freedom, when you look at Catholic organizations or some other strongly religious or organizations like Hobby Lobby. Because if you don't know, Hobby Lobby is closed on Sunday because they're not Catholic. They are, I believe, they are some sort of fundamental Christian sect, the owner of that organization. So they don't open on Sundays, and they don't want to provide contraceptives because it goes against their beliefs. How could it be made better? This seems moot. This is one of the things that I look at and say, who the heck knows right now? But this is how potential future improvements or reforms that would make sense to the Affordable Care Act. Stabilizing those healthcare marketplaces, trying to make insurance premiums more affordable, trying to get more subsidies to help more people get insured, tweaking the employer mandate, because we don't want smaller employers to go out of business because of this, but we do want people to get coverage. Continued reforms to Medicaid, and then the big thing that has to be done if we continue with the Affordable Care Act in the marketplace is looking at out-of-pocket costs, because the deductibles and co-payments add up, and even if people can afford the premiums barely, they can't afford the co-pay so that they can get care. Trying to encourage innovation in the healthcare arena. I mean, nurses are a huge part of that. When you look at advanced practice nurses, the care that they provide is quality and it costs less. Looking at preventative care, addressing social determinants of health, being smart, looking at care coordination, all those things to make things more efficient. And nurses are a huge part of that. Taking on prescription drug costs. I'm very sad that the current administration signed an executive order taking away the previous administration's drug cost caps. I don't think they did it just to take away drug cost caps or anything like that. I just think it was one of the parts of another executive order that President Biden had that the current president wanted to get rid of. We don't know what he will do in the future, but we do know that in the past 2 weeks he is putting forth what he thinks reform should be, and we're just going to have to hold on tight and see what happens. Continuing to address health disparities, enhancing consumer education and enrollment, let people know what's available and what assistance is available, and then looking at flexibility and regulatory burden. You want people to have flexibility, both the states, the insurers, and the businesses, and those of us who would, in our country, that would be purchasing in the marketplace, trying to make things flexible for them too, but trying to make it as cost effective as possible for the insurance and the people who are looking at the regulations, trying to reduce the administrative burdens that they would that would affect them. But the thing about reducing regulations is that also reduces consumer protection. So you need to be very careful. So that's the end of part 1. As I said, I don't know what's going to happen. None of us do, but it will be interesting. And maybe we'll have some idea before the end of the semester what's going to be happening, when it comes to the Affordable Care Act.